Let us start the class.
Okay.
Welcome back, friends. I have two requests. When you are asking question, please come on video and ask, because I think it is very respectful, and because resource person, if he sees us and answers it, it makes some connection. So I really, I think kindly do that and keep your mics off so that you don't get any extra noise. And today we are trying to, we have sorted out, if any issues are there in terms of the audio output. So, that problem has been solved. So, you can go ahead. Over to Dr. Dandana.
I can. Some voice is not clear.
And one more thing. The second thing, please reserve your questions. Last 15 minutes will be for question and answers. And any question, any doubt you have during the session, please note it down, because we don't want to interrupt the flow of the lecture. Please comply with that. Thank you. Please note down your questions. And last 15 minutes, when we give for question and answers, please ask your questions. Yeah? Thank you. Yes, ma'am. Go ahead.
Okay. Just a minute. Sharing. Okay. Am I audible, visible?
Yes, ma'am.
Okay. Yes, so good evening, everyone, on this second session of music therapy. And what I have planned to share with you today is that first we'll see how to evolve with a complete matching. Complete means as much as possible. Matching between the kind of music you choose and the kind of person, the client which you have. Like, it's not just picking up any musical piece and giving it to anybody. No, that is rather than contributing to the health of your client, that is going to do otherwise, right? So we'll be talking about different personalities, how do they have different musical preferences, and in selecting the music piece, you have to take into account the personality of your client. Then we'll be talking about the situation, the mood, the weather, the timings, and all these factors, because in deciding as to how to evolve the tools, which kind of tool is to be used, like yesterday we talked about different tools which are to be used in music therapy, whether therapy has to be based primarily on rhythm or on melody, all these things, they will be decided by you as a music therapist only when we have different kind of individualized needs-based information, right? Why is that important? This is very important. Why? Suppose your client does not have musical skills, it's okay. It will do. It's not necessary that he should have musical knowledge or musical skills, it will do. But in case he's not involved in your music therapy session, it's just a wastage of time. It's just a wastage of time and energy, because then we'll not be able to contribute to anything. So how to motivate your client so that he's involved, so that he's active, so that he's participating in whatever you are going to go about that. So as I said, that various things are very important and we have to take into cognizance before we deciding the tools, the strategies, the activities, and all other details which are to be included in music therapy. So first we'll take up the personality. Of course, there are so many traits and each trait, it has inter-individual differences. One person is differentiated from the other person. So what you are going to use for one person may or is not applicable on the other person. So you will have to take into consideration. I'll take here some of the very important traits, though every trait is very important. Openness to experience. Suppose this is a trait. The first thing is that whether you have explored the status of this trait in your client. If yes, then you will come to know that intellectual curiosity, aesthetic sensitivity, attentiveness, imagination, all these things are, and your client is a person who's openness to experiences, who has openness, that means who is open to change, who is not rigid, who is flexible, who is ready to take the change as challenge. It's not just openness, just see how many characteristics they are related with that. Your client is a person, if he scores high on openness to experiences, that means he's the one who is open to change, not rigid. Taking change as challenge. Why? Because he himself is open to change. So any change is welcomed by him. And one of the property of openness is intellectual curiosity. So not rigid, not sticking to one thing. सवाल उठता है कि if your client has this kind of personality trait, then what kind of music preferences they go along with that? There are a number of researchers. They have tried to cover different personality traits and music composition preferences matching. And the researchers show that suppose openness to experience is being scored high, then people are more keen for something complex because intellectual curiosity is there, change is there, challenge is there, competence is there, and we can say the hardiness part is there, resilience is there. So person is ready to take, his preference for music will be not very simple kind of thing. It will be a complex, a challenge kind of thing. And he is not rigid, so he has interest for diverse musical styles. He is the person who is keen for making different varieties of musical notes. But one thing which researchers they have shown is that he does not prefer, this is research finding, does not primarily prefer popular forms of contemporary music. Why? Because he is the one who wants change. So he'll not stick to one form of popular, rather the complex music which is more variety oriented, styles which are more diverse. So suppose you have to, you have identified this personality characteristic in your client, then the music which is to be chosen by you is matching with him. Let's move to other one. Extroverts, as everybody knows, that they are the one who do believe in engaging in social activities, cultural activities, social connectedness, interactions, outgoing, these kind of things. These traits, they do go along with the personality of extroverts. Now, the researchers show that upbeat kind of, a fast kind of, a little fast kind of music which is more energetic kind, which is more rhythmic, dance music is being preferred by extroverts. And they tend to have those, that music which is in a way energizing them, which is activating them. And they prefer always to, not always, but most of the time, if music is there along with every activity, it will do. So if your client is extrovert type, you have to choose this thing. But suppose he is introvert type, this will not do. This will not do. He'll feel what rubbish it is. This is like it is just a headache. What kind of atmosphere was there? I was not comfortable. These kind of things. And then what kind of therapy condition, therapeutic intervention benefit will be able to, perhaps will not be able to. Agreeableness. People, they are highly pro-social in their approach. Pro-social, sympathy, empathy, aiding, sharing, helping others, cooperating others. Agreeable kind of people. Researchers have shown these characteristics in your client. So they'll prefer upbeat but conventional music. Upbeat is upbeat but conventional. And emotional responses, because they are more concerned with others, they are trusting kind. Trust is something, the base of social connection. So they are trusting kind. So emotional response to music, this is very important in the case of agreeable people. So we cannot cover, but some of the personality characteristics which we can see, that if a person is open to experience and we are using some rigidity kind of things, it will not work. If person is introverted and we are using extroverted or extroverted, and these things will not do. So you will have to explore the personality status of your client before you decide as to what kind of music has to go with that, right? Then there is situational influences. It's not just personality, personality and situation, they combine together and they affect the mood state, the cognitive states, psychological states of the person. Different researchers, they have shown that when the client is in a sad mood and you are trying to impose fast music, it will not work. So loud, strong rhythm, they will go by that kind of situation. And if the situation requires, if the situation is such that a client is gloomy, or because of some tragedy, or because of some problem, or somewhere he is in a melancholic state, then fast music will not do. Rather, what will do is maybe that low volume audio they'll do. But if the client is in a high arousal state, then maybe that a little louder or strong rhythm or loud melody. So situation always and what the situation means, your client has come to you, right? His counseling goals are there with you. So counseling goals, they tell you as to what kind of situation he is coming from. Gender, it has been found to be very important as usual in psychological studies, because socialization practices at the time of birth only, they decide as to how is it going to influence the things. So researches, they show that women, they responded to their responses were more based on the popular music, which is up these days, which is current these days. And they were found to be more emotional in their expressions, women. But male, they were not found to be so emotional. Their musical choices, they were not based on that way emotions, as for women they were found to be. And for males, it has been found, and I have seen in my family also, like males, they do prefer, and maybe that Dr. Krishnan would agree with me, they do prefer low bass music, where it's not that high kind of things. I have generally noticed this also in my family also, that males, they have this kind of preference, whereas females, they have another kind of it. So you'll have to see, if your client has come to you, you should have this information. Then of course, age is very important, and age is not the one variable that they, because with age the musical preferences, they change. If it is enters into responsibilities, the music preference also moves from to a more sophisticated and to a more kind of composed, balanced, and comparatively low. Heavy music and light music, these two kind of things are very important. Heavy music, any music which creates heavy environment, and light music which creates a light environment. So heavy music was found to be in those adolescents, their preference for heavy music, those adolescents who were having low self-esteem, they were not comfortable in their families, they used to feel that they are rejected in their families, their preference was heavy music. Whereas when the other was the case in light music. So this information, like what you need here, you need the information, the counseling goal. What is the counseling goal for which you have to structure your music therapy session? So if your client is adolescent age and coming from a discomfortable family, having some problems with the family system, feeling rejected or neglected, and as a result, he is having low self-esteem, his preference would be, he's not going to tell you that my preference is heavy music, but through these researches, you will have to find out as to, because counseling is not as simple that somebody came to you and you start providing counseling. And that is why my all psychologists, they would agree with me that exploration itself is a very comprehensive kind of job. So even in music therapy also, it requires that thing. Season is very important. Researchers show that in winters, they were found to be more complex music preferences, whereas in summers, it was comparatively the simple music was preferred. Daytime is very important. In the morning, when you have to go for, like, generally you'll see that in the morning people, they do put kirtan, bhajan, some devotional kind of things. But as the day proceeds, or by the end of the day, they would prefer more relaxing kind, because the whole day they have been with their work and now they want to relax, they want to get. So what is the time? That again is very important. And I was just talking with one of my colleague over here in this session only. Season is such an important thing, that the whole branch of raga therapy, the whole area of raga therapy, it's not just picking up any rag and start singing that. No, we can have different examples, different episodes. Like if you remember Tansen, like what happened, he was asked to go for a particular rag which started, rains they started, and then there was another episode where the rain started, where fire started. So this is the power of music. It's just not that picking up anything and start doing that. And here we'll see, how does season affect music preference. I'll put Rag Bahar, Rag Mia Malhar. These are the ragas which do contribute to rain season. और ये कब गाई बजाई जाती हैं? Only during the rainy season. Just let's see. Yes, that was Rag Bahar. Cham cham nachat aayi bahar. This was the bandesh. And those people who know about Rag, they know that Nishad is Nishad, but the way both Nishads, they are put together, the Shuddha Nishad and Komal Nishad, while in descending note, that creates the impact of Rag Bahar or Rag Mia Malhar. But see, we could, just by this small video, we could feel that yes, Cham Cham Nachatai Bahar, and that's the impact of music. And you have to create that for your client so that he also feels as we are feeling right now. Anyway, another point which is to be taken into account is self-views. How does he, what is the nature of his self-perception? Where does he put, how does he perceive himself? As conservative, non-conservative, conventional, non-conventional, progressive, non-progressive, positive, negative, like what is his view? And accordingly, you will have to select the kind of music. And one of the ma'am, she was just talking about, she's a sports psychologist, and I was very happy to know that. Athletic self, if a person has this self-conception that he has the athletic self, then make sure that vigorous music is required in his case, rather than low sound, or rather than low beat vigorous music. So dear viewers, you should know, listening patterns are very, very important. I'll tell you why. What happens, suppose there is a music program, right? And I'm ready to go, let's say, pay a heavy amount for the ticket. I'm ready to go to 20 kilometers. I'm ready to devote 4 hours with me. And the other person who's equally interested in music, but he's not ready to go for that, for those things. So music listening effectiveness, this is going to be different in both of these individuals, because one person is ready to put that high cost for the functional effectiveness of music on him, maybe on emotional state, cognitive state, entertainment, aesthetic value, spiritual value, whatever it may be. Whereas the other person may be equally interested, but that cost part for these upliftments, they are not there. So listening patterns, they are very important. You will have to decode what are these patterns in your client before pinpointing the music therapy package. There are two basic ragas which we were just talking about. One is rag based, the other one is the genre based. Rag based, as we all know, this is based on composition of swaras, and these swaras, they move through the sound, which is rhythm. So you can apply rag based therapy, or you can apply genre based, which is more concerned with the socio-cultural background. And let me tell you, dear viewers, here one thing is very important. We were just talking about maybe that somebody at the age of 40, 45, and you just put Western music on him. Maybe that may not be that effective. If you have really gone to these dynamics of the personality of that person, then you have decided with a drug based, what is the indigenous requirement. Music is not just picking up any piece and giving it to anybody. Indigenous requirement. Indigenous means which does come from our socio-cultural background. Why? Because then involvement is more, then activity is more, then entertainment is more, and then seriousness is more, and then we feel really active mode as far as that music composition is given. So if it is rag based, that does not mean that your client need to have complicacies of ragas. No, even you are not supposed to have those complicacies of raga. You can always consult. It was a question yesterday. You can always consult a rag therapist, and with the help of that, you can decide as to this is the structure of structure, dynamics, process, the personality of your client, and then which raga is to be used here. As far as the genre-based approach to musical choice is concerned, this is more to do with devotional songs or folk songs, because even before birth, like at the time of baby shower, the music is a part of up to the end of when the person is ready to move. In northern India, people sing Ram Nam Satya Hai, Ram Nam Satya. So starting from even before up to the end, that music is there. The genre based is more to do with the particular culture. If folk is Tamil Nadu is the place, wahan ka folk. If Punjab is the place, yahan ka folk. So bhajan, kirtan, or devotional songs and other these things which are more imbibed into the socio-cultural context of your client, they need to be taken into account. And even Bollywood cinema, this can be very, very effective here. Because every song, even if it is Bollywood cinema, as yesterday we did a little activity where we could see, and Jeevanji, he was so highly verbal about the things that Zindagi Hasne Gaane Ke Liye, this is not that loud, but still it is conveying all those emotions. So cinema music, Bollywood music, this is equally important. So you have to decide musical piece kahan se lena hai, rag therapy based approach, or it has to be let's say genre based. So what is the summary? To some we can say that this is not the complete picture. These are just the main effects of some of the primary variables. If we talk in terms of research methodology, just main effects of some of the primary variables. There may be a number of secondary variables. There may be number of interaction effect, personality interacting with age, personality interacting with gender, gender interacting with social. So 2 by 2 by 2 by 2 by 2, I don't know to what extent we have to go, right? So my researchers, please make sure that music therapy package means the design, the structure, it has to be decided by you, keeping in you these primary variables, their main effect, their interaction effect, and then we have to make a move. So with this background, I'll make a move to one of the common problems these days which people do suffer from. There are again two categories, two ways. One is the day to day. Everybody has low feelings, sad feelings, but when it becomes a part of life, when it becomes a style of life, it may create trouble. So there may be day to day depression, there may be a clinical depression. So we would now see uh, to be specific about as to how to deal with this mood disorder, personality disorder, or let's say some sort of emotional disorder, depression. Everybody knows about that. But before we proceed, these are the symptoms which are understandable. Low and sad mood most of the time. Then difficulty completing daily activities. You are finding it difficult to complete them. The activities which you used to enjoy in the precondition, now you are no more getting any fun out of them. You feel that you are drained out of your energy, tired without any reason, mentally tired, physically tired, overthinking about irrational things, over feeling about the things, and then overreacting most of the times, leading to low self-confidence, low self-esteem. And then you have this the self-debilitating kind of attributional styles. Either there's no, you don't, there's no appetite, you don't eat, or you just go on eating. So either of the things. Sleep patterns are highly disturbed. Self-blaming, self-harming kind of etiquettes, and in extreme cases, it may lead to, of course, suicide or death also. So this is the picture, right? Now, dear viewers, now the job is yours. Okay, I'll show you a picture, right? And then you have to design a music therapy structure. These are the symptoms. Like this is your client. Rather, let's say this is your client, right? All psychosomatic symptoms, the physique, the mind, the brain, everything is there in front of you. Now choice is yours. I'll give you 1 minute. Take a design a music therapy package for him. Virtual. Just give me the mobile. And if water could be.
Sure.
Yeah, it's okay. Some activities going on. So shall we come back to the task? Anybody who will take initiative in sharing the music therapy which you have designed? Because now things are clear. You have got yeah things, right? And some of the data, if it is not there, you can assume also. But make sure that you write a paragraph as to this is the music which I am going to, because your client is sitting in front of you. Yes, shall we start? Okay, now who would like to take initiative? Please come up and share your package of music therapy. Am I audible?
Yeah.
Yeah.
I just thought, ma'am, if I may say so,
Right.
maybe because the person is anyway showing low energy, I may go for some music which will be far more, stronger, rhythmic. So maybe some drum or some, little loud, energetic, maybe something like a bhangra kind of music. I don't know. Just
Okay, very good, very good, very good, very good attempt. Because what you did, you could really get the nerve of this client, right? Maybe that all those things, discussing the personality and everything, but you could get the nerve of that fellow that everything is in a miserably low state, right? And you could really get the main goal of your client also. The purpose is first to उसको खड़ा करना है, सीधे करके खड़ा तो करें ना, the first purpose. So Sita, very good attempt. Anybody else would like to share, please? Yes, yes, please do share. Jeevanji, would you like?
Yeah, I will
please.
actually.
Yeah, I saw you unmuted, right? So I was prepared that you are prepared. Yes, please.
So in this case, actually, the client age looks young, like 20 some age young. Also, we don't know about what culture he's belonging to. So these things. But apart from that, whatever variable this things is showing, so there are a lot of negative emotions is going around. So I think little bit of music which will give some energy, a boost kind of thing, like not like loud, similarly not very low sound, because if you give low sound, again he will go to the sleepiness mode or very lazy mode or very kind of like it's not like conscious enough to like handle, right? There is a lot of sweating comes and it's not happy enough also. So I think as you said, the lower like Western kind of thing, so that does not fit for him. And even this lower, very lower thing, that also does not fit for him. But we need some kind of like, as ma'am also said, a little bit of drum, which is not that uh, impactful to them. But still, we have to bring him to the awareness first, to steadiness. And also, I feel that the drums could make him the heart, this heartbeat, little bit of more, not like very fast heartbeat, I'm telling, but little bit of affecting his inner organs I'm talking about. So whatever. So that I think it bring little bit of energy, not like out of 0 to 10. It's not like is directly coming from 0 to 10, but might be from 0 to 3 it might become. So if it's coming in that point, I can understand. Okay, then he can able to tell it more things to me. Okay, this is a song I like or something like that. And after that might be when he reaches a third, and I could bring some lyrics to them, which can make them internal trigger that I should feel happy. After that first thing happen, might be if I will get the right music, I can combine both. Like as you played yesterday also, it is also have the lower audio and have the good lyrics also. So if I get some kind of music, then definitely I will show it to them, because he need both in this situation, because he need the right words to support them to change his belief system, because you think he's very nervous, and so his belief system also needs something to emphasize on his emotional impact. Yeah, that's all.
Yeah, very good, Jeevanji. Yes, many other things are already going on, but music therapy should be one
Participants,
thing.
please, Madhanaji, एक minute.
Yes.
Participants, please, when you are talking to research person, please come on video and talk.
Yeah, exactly. Jeevan, one thing which you really added was something very important. You started with one variable, and you showed that you are curious to know about that. And that was the culture he's coming from, right? That's something very important. Because all psychosomatic symptoms, they are there in front of you, right? All psychosomatic system, digestive system, allergy, frequent headaches, numbness and tiredness and sleep patterns, eating patterns, everything is out of control. So you are ready. How to make him ready so that he's ready to listen to you. He's ready to get involved in the music therapy sessions. But one thing which you really added to this thing, that you would like to know the indigenous things which are associated, because suppose he is from Kolkata, then just and from Robin Resongi, then maybe that just putting him into a Punjabi song will not do. So that's wonderful. Yes, so somebody else is, yes, Rashmika want to share. Yes, please. Not audible, Rashmika. You're not audible, please.
This is
Yeah.
Yeah. So I had like a slightly different approach in a sense, like observing the image itself, I could see that there is lots of expectations. And if you could observe that there's a lady who's like literally, talking things, like there's somebody continuously telling things to that person. So it just means that there's lots of pressure. So for me, handling pressure, I would probably be slightly different from the others in a way that I would want to first soothe him, probably give him that relaxation, because I feel lots of the symptoms that have been probably that have been mentioned are all consequences of pressure and stress. So I largely felt that probably giving him that relaxation, probably getting him down and probably getting him relaxed, and then working on his motivation would give him like probably give him like better results according to me. So
Yeah, very good.
that was
Very
my
good. Yeah, Rashmika, very good addition to that. So we have one place where the counselor, the therapist says that drumming some fast this thing so that he has to listen to you. Then Jeevan said that culture is to be assumed here. It should be important before we decide anything. And then Rashmika added one thing. She said that first make him relax and then decide any other thing for him. But for relaxation also, Rashmika, you have to have something, because how can we relax him? He's your client, right? For relaxation also, you'll have to find out some background information, because all other therapies, they are already going on. It's not just a person with psychosomatic symptoms is only for the music therapy. Maybe cognitive behavior therapy is already on. Gestalt therapies may work in this case. Humanistic model may work in his case. Social support mechanisms. Your observation was very unique, where you could see that lot of pressure. Just see mother, doing just that bag of expectation, self expectation, peer expectation, parents expectations, teachers expectation. So maybe that expectation is that heavy that he is not able to stand, right? So your observation was very unique in a way. And then yes, we do all agree. Now we have got three steps. The first thing is to relax him. The second thing is to decide the music composition, get the cultural information, the socio-cultural information about him. And third thing is maybe that fast music or the drumming or these kind of things, they are able to energize him, activate him, so that he's at least able to understand. So all these three things are very, very important, and that is what we are going to. Relaxation, then getting other background information, and then of course deciding what exactly to do, whether drumming or what kind of. Okay, so very good attempt, my dear colleagues and viewers, right? So let us make a move now. As we really talked about this therapy yesterday also, and I am so fan of it. All those 5 elements, they are based on the fibroacoustic therapeutic models, right? What does this fibroacoustic model does for us? Number one, what do we do? Some pre-recorded sound is there, as we have already seen yesterday. Some pre-recorded low volume, just audible. Just see 3 things. Pre-recorded sound, which is low up to that extent that it's just audible. It is not making you cognitively active, just audible. And then it has to be supplemented with a constant vibration, again very low intensity. And sometimes try doing these things with you. I have tried these things, and they really give you lot of regulation part. They modulate you, they regulate you, because this is the mechanism through which that client, always keep that client in your mind, his emotions, because one of my colleagues said that emotions are important because of pressures he has given up perhaps, and then the body, lots of psychosomatic symptoms. So that client, our client, he was under the pressure of emotions, cognitions, social pressures, physiological pressures, physical pressures. So vibro acoustic model, it claims that it is able to maintain a harmonious balance between the emotions and body, and it energizes the body, it activates your emotions, because in the case of depression, what is there, everything, it goes slows down, slows down, slows down, slows down. So there is a harmonious balance between your emotions and body, which really stimulates your whole body, your mind, your brain through vibrations. So such a therapy which I am so fond of, I'm so fond of, and this is highly functional, highly workable in the case of dealing with depression. And then, as Sita ji said, that drumming can be one thing. There are so many other things also. Drumming can be, then you can have bhangla. Somebody said in the beginning, loud bhangla, or what may be different activities which we'll see later. But yes, vibrations, and then low audible sound, and then so that the whole body energy is regulated, the whole brain is activated. Vibroacoustic therapy, it has primarily three hypotheses, three assumptions, and it is being proved on those assumptions. These are: high pitch gives stress, high pitch, shrilled voice, and low pitch gives relaxation. These are the findings of vibroacoustic model. One of the assumption is that if very loud, high pitch, in case of, we are talking about depression, it will further add them stress. And I think Rashmika did talk about that. And low pitch, it is going to induce relaxation. And in vibroacoustic situation, we have seen that it is low, just audible sound with continuous constant vibrations. Sometimes you may put it in the bed of that person, your client, or in the chair of that client, or maybe wherever he's for most of the time. So you can use that. So one of the finding is that avoid high pitch, go for low pitch, just audible sound. It is rhythmically strong music, rhythmically strong. Just see, we are not talking here about melody, we are talking about rhythm. And as Sita said, that rhythm is very important. The rhythm, just clap for 10 for 10 times and see how energized you will feel yourself. So rhythmically strong music, it increases energy, whereas if it is rhythmically neutral, it takes you to more serene state. It decreases your energy, pacifies yourself. Loud music activates, whereas soft music, it pacifies. It puts you into, so maybe that soft music or rhythmically neutral music, all these are different. This is not one and the same thing. There may be soft music, but pitch may be a little louder. There may be loud music, but pitch may be a little lower. Pitch is something different, and softness and loudness is something different, right? So basic assumptions of why vibroacoustic model is so effective in case of depression, because first thing, it talks about low pitch music so that relaxation is induced. Rhythmically strong music so that energy is induced, and then a little loud music so that activity is induced. And these are the three aims which need to be done in case of, because his energy has been drained out. So before you do anything, maybe that for cognitive behavioral therapy, how can you go about that? If your client is not in a state to listen to you, is not in a state to sit properly, is not in a state to communicate with you, I think no therapy is going to be effective. So maybe that relaxation therapy through music therapy is going to do the precondition here, that is the wonders for you. Then this is movement therapy. And what Sita said, it was more to do with the movement. Movement is energize him, put him as much exercises physically as possible. And so many researchers, they have already proved that physical exercise in case of depression, it does wonder. It is very helpful in treating the depression. Why? Because this is based on movements, right? So once we take movement therapy to the music therapy, this is DMT, dance music therapy, which is a kind of movement therapy. Or it can be MM therapy. This can be movement music therapy. Like you just give a guitar to your client and just ask him to bang on it. He'll just do low to high, high to low, low to high, high to low. And that is going to unblock his energy. That is going to open his blocked systems. Banging on a drum, again, I would say what Sita said is perfectly. Just give a drum and ask him to bang it as much as possible. Any dhol, any manjira, any musical instrument, which of course after banging is not going out of order. So movement therapy says that these kind of musical activities, if they are into your music therapy package, they trigger the movements. And these movements, they are very important in treating the depression of the subject, right? So do that. All these kind of, any music is played, you start nodding your head, you start tapping your foot, you start moving naturally. These kind of movements, they can be made a part of your music therapy. They can be made more loud. You can put some exercises on your clients where these naturally occurring movements, they are made louder and louder, so that you could really activate the client who is in a state of depression. So movement therapy is very important. Dance movement therapy says that it of course physiologically it is arousing, psychologically, emotionally it is arousing, but DMT is very, very important when you have to explore your client. In what way? You ask your client, let's say you give a safe space to him where he's supposed to dance, right? And while he's dancing, what is he doing? He's expressing himself. That expression itself energizes him, and that expression gives him the cathartic value. That expression, he is going to connect his own emotional tone. Like if you ask two persons to dance, they are not going to dance in the same manner. One will give one expression, the other may give another expression. So these different expressions, where are they coming from? They are coming from the language. This is the language. This is the dance, is the movement language. This is not the verbal language. This is movement language. For verbal language, you can put control, but for movement language, you don't need that there is. So it is highly confidential state where you have provided a safe space. So your client is able to express himself without any sort of shield, without putting any guarding ki main kya bataun kya na bataun. No, it is expressive art therapy. He is expressing his emotions, his cognitions, his memories. He's going back to his memories, and all these things they are. So now 3, 4, 5 things are being done by it. But let's see what else it does. Those dance movements, you are the analyzer, you are the music therapist. Through those expressions, your client is going to let you know about the conscious, the subconscious, and the unconscious feelings, which may not come from otherwise conventional level of tests. You'll have to go for, let's say, projective techniques, but these expressive arts therapies, especially dance movement therapy, you can know about the unconscious, repressed desires, wishes, and there is no guard on your client, because it's a confidential. He does not know that you're going to analyze. So verbal is always to be guarded, but this is language, movement language. So everybody is comfortable. Movement vocabulary. It is also his movements, they are giving expression instead of words, right? So that verbal part, whatever hindrances are there, this movement vocabulary, movement language, expression of movement, regulation of emotions, all these things are there when we are talking about. So DMT make him, and people are using it these days. Movement therapy is very, very popular, especially in the case of stress, anxiety, and depression, these kind of low mood states, problems. So as we have already seen, the first thing is that you can assess, you have explored your subject. What body language he is using, what body language, because dance is not just doing some of your, if you know, there can be a theme on Sita, there can be a theme on Mahabharat, there are different dance types, like in eastern part of, you go to Chhattisgarh, Pandavani, like they don't speak much, but through the dance, they portray the story of Pandav, Kaurav, it is Pandavani. So whenever Hema Malini goes to these temples, she always portrays Ganga, she portrays Saraswati. So what are these dance forms meant for? These dance forms are the expression of that particular theme, which is you are being. So now what happens here? You have given a theme to your client. He is dancing on that theme. So his body language, his non-verbal behavior, his emotional expressions, all these things, they are there, ready-made information to you. You can use either of these modules with you only, because you are a facilitator. When dance movement therapy is used as a music therapist, you are a facilitator. What do? You, whatever your client does, you also do that. And then you try to get what you inferred, you try to get that validated through showing your empathy for those movements which your client has shown to you. Then DMT uses jumping rhythms, like in group therapy. I have seen people using it very frequently. Let's say 4 or 5 people with depression, they are sitting in in oval shape chairs. Then some sort of, depending upon different matching strategy, music is, but one nature is very clear, music is loud, and then they are supposed to jump at their own places. So that jumping itself, you can see the facial expressions, the body language, their emotional expressions, because in depression state, everything is in a dormant, cognitively, emotionally. So jumping rhythm is one of the module which you can use. Then you can use movement metaphor. Metaphor means what we were just talking about. You're giving your client a theme and he has to dance on that. Sometimes you also become a part of that because you're a facilitator. Sometimes, and what theme you are going to decide, this is again, this is not just taking any theme and giving it to him. The theme has to be decided keeping in view the counseling goals, individualized counseling goals. So these movement metaphors based themes are given to your client, and then as facilitator, sometimes you help him in enacting those dance patterns, and that is how you you go to the treatment part. And then, of course, psychodynamic theory, gestalt theory, humanistic theory, and then cognitive behavioral therapy. These are different theoretical forms, and these are maybe it is eclectic approach where you are using a combination of all of them, or maybe that primarily it is one of the therapy which is to be used here, but that is going side by side. That is going side by side, because you have to find out the social support also. You have to go for irrational thoughts also. You have to help him in rewiring his brain also. You have to train him for emotional regulation also. But then what Rashmika said is very right, that the precondition is to make him relax. And here again, music therapy is standing very strong with you, that yes, come to me and I'll do that for you, right? That was the vibro acoustic model, then movement, then dance movement. The second part is in the treatment of depression is talking about the active music therapy. Yesterday we were talking about two types: active music and passive music. Active music, where and its researchers, they have strong results when they claim that music editing, music improvisation, music singing, music enacting, choose any kind of these active music therapy and ask your client to, if just go, let him go on singing as loud as much as possible. No, if soul does not matter, emotions does not, just go on singing, so that blocked energy, it will get its release, and you'll find it. The catharsis part is always very, very important, and you all must be aware of that. Catharsis is always there, expression is always there, and then he's not scared of whether people will come to know what, but he's just singing. That singing is going to add to the treatment part. Then another thing which is very, very important, because every client of us has some or the other hobbies. Because some cases it may be photography, in some cases it may be gymming, in some cases maybe dancing, painting, drawing, writing, or number of other hobbies, cooking or washing or cleaning. There can be a variety of activities which your client, maybe one of them would like to, or whatever, maybe it is not there in the list, but whatever your client really wants to do, what is his hobby, try to find out, and then supplement music with that. Supplement music with whatever activity, whatever hobby your client is like. Suppose I'm fond of cooking, so make music, introduce music in part of each cooking activities, carried out. Suppose I'm fond of writing, so writing, introduce music as a supplement, as an additional this thing. Because these things, they do two things for depression. Number one, they relax. Music is relaxing here, and making the problem orientation move from problem orientation to more to the coping of positive coping, that is the solution focus. Music has the power to do that, from positives to negatives. So do this apart from vibroacoustic or movement or dance. Make sure that these general things are also the part of your music therapy. And of course, as we have already seen that also earlier also, that all these things you are doing, but side by side, the psychotherapy is already going on. Maybe that your client is on medication. So whatever his side things are going on, let them go. The music is doing extra favor to you. So this picture now, what happens? Medication is going on, psychotherapy is going on, maybe gestalt therapy is going on, or whatever things are. He's singing also, he's playing instruments also, he's breaking instruments also, he's writing musical improvisation, he's putting bandish also, he's doing a lot of musical activities. But sometimes what happens, he's not doing, he's not coming up. Then what will you do? He's not coming up. Then you as facilitator, you become a part of that situation. You start dancing with him, you start singing with him, you start playing instrument with him, whatever way, so that he's engaged into that. Why? Because in general, what happens that music therapy, it brings expression of memories which is not to be dictated in form of language. Memories of your depressed clients, they are more based on hurt, the kind of emotional pain, the kind of psychological scars, the kind of non-supportive social setup, the kind of different not happy state, not happy state. His memories are associated with them. And then this pre-verbal expression in form of music therapy is going to help you in exploring your client more and more. Then do one thing. This is very, very effective in case of all these problems in stress also. A couple of mantra chanting, they have their own brain activation mode, and they have been found to be very, very effective. And here I would play just a video for a second, and you can see how different parts of the brain. One side is this side, the other one side is the side of the brain. You can see how different electrical stimulations they are going within the brain when Samved mantras they are chanted, right? Okay, so just get a
Dakshine
yeah. So that's the power of music. That's the wonders of music therapy. It activates the whole brain as such. Otherwise, what happens whenever we talk about the stimulation therapy, multiple stimulation therapy, what do we want to say? Multiple stimulation means your auditory, visual, tactile, taste, smell, all these things are to be activated so that your whole brain is activated. But music has the capacity where you don't need to go for. If you go, this is ideal situation, perfect situation. But it claims that it activates a major part of your brain, and that is how it is able to treat the condition of depression or other these states of us, right? So that is how we can go into the in structuring the music therapy session for depression. And now we would go to some of the activities, but before that, the history of music therapy in India. And as Krishnanji said, that Bal Murali Krishnan, he was the one who really started. He was a pioneer in starting. Of course, music was there as back as human beings are there, but that taking music to the therapy part, that was the one which Dr. Bal Murali Krishnan was the pioneer in. Yes, so once we talk about, of course, prehistoric, then Vedic, then medieval, then modern, there are different classes in which music is divided. But as far as medieval period is concerned, it did some of damage to our original music. Though we could get something new and fresh, but that originality was something, because Mughals, they entered India, and apart from influencing the political scenery, what did they do? They influenced the art and the culture of our country also. So what happened that North India and South India, it never used to be the division earlier, but then there was a division, South India, North India. North, since it was inhabited, Delhi used to be the center. So what happened that North India, the music in North India, it got impacted by the Persian music. which the invaders took along with them. And that is how Hindustani music it emerged. But then the south part, the music was labeled as Carnatic music, which is supposed to be more original, because in south we could maintain the originality of our musical feel, which we could not do in north because of the Persian impact, because of these invaders. So though Carnatic music also at present it has a lot of improvisations and modifications, but still we can say that we could afford to be having stable roots in our ancient music even today. History, yes, as we can see that prehistoric, Vedic, medieval, modern, whichever is the age, music has been very, very powerful. Ancient cave paintings, they tell us that music used to be as instinctual as the language part. It was so imbibed in the human nature as the language is. You don't have to learn, you don't have to teach. It is instinctual in the same way. And ancient cave paintings, since I have a little bit interest in history and some archaeology also, I could find a structure which is purely a flute structure, though there is a lot of debate, but it has been found, this picture has been found in the ancient cave paintings, and this is this. And the history says that this is the flute, bamboo flute, which our ancient people, they used to play for their musical purposes. Yes, dear viewers, फिर आपकी बारी आ गई, right? This is the activity. Take out your paper and pen, because we have covered a lot of basic things to be decided in music therapy structure. This activity, I'll show you one musical audio visual piece, right? You be very minutely observing that. What is the sound? What are the sounds? What is the music? What is the background? And then how to design a music therapy program based on that. Okay? Yes. Okay, ready? Okay. Take out your paper and pen. Go into the dynamics, structure, the process, everything in this audio visual slide. And just come out with whom are you going to give this piece as a music therapist? What conditions you are going to use it as music therapist? 1 minute for the activity. Okay. Are you through?
Yeah.
So the question is, what are the characteristics of this musical note and whom are you going to give it to? Right? So,
Ma'am,
yes, please. Any
it's
question?
energetic sounds, ma'am.
Yeah. Who is on the this thing?
Sorry,
Okay.
I'll start video.
Okay.
The tone is very energetic, ma'am.
Okay.
Yeah. So this can be given to extroverts who enjoy that music.
Okay.
And also if the client is in depression mode, in order to energize him, we can give that.
Okay.
Extroverts who face some issue, and they, after hearing this note, they will feel happy.
Okay. Okay. Manjula, right?
Yes, yes, ma'am.
Yes. Okay. Yes. Anybody else? Yes, Sita.
So when I was hearing the music and also looking at the visual, for me what came across is a lot of this damru and that Shiv Tandav kind of thing, and also the Raudra emotion. So probably I would give it to a person who has his emotions very suppressed. I would probably ask them to express their emotion of, if there is any anger, if there is any latent feelings or anything which has been, which is lying low, I would probably ask that person to, play this music and ask them to kind of come out with that in whatever form they can. So, that's how it was playing within me. I don't know.
Okay. Okay. Yes. Anybody else?
Yeah, ma'am, I can share.
Yes.
The characteristics, like I'm saying, it's like it's a rhythmic, very rhythmic. So the pattern is again coming, and the drum is there, and also bell ringing. Two things I'm able to listen it. But yeah, as I said, that the drumming is not that aggressive, but the Shiv Tandava is happening, and also ma'am said about the if he's very anger or like. But I feel like it's more openness. The person could be very openness, and if he feels somewhere he's not uncomfortable or something like that, it's not um, some anger is going something like that. But this could suppress this things, I think so, because of the repetition. Without the rhythmic thing happening again and again. So it might be make if I miss like this peak, so it might be make me in some other like because of rhythmic
Okay.
thing.
Okay.
So, yeah.
Good. Yes. Anyone else?
Ma'am, Usha here.
Okay.
I found that the characteristics of the music piece were awakening and stimulating. So somebody who needs stimulation to start something, to come out of a depressive and dull mood, I felt it could be used for people like that.
Okay. Okay. So anybody would like to summarize the thing? What was said by everyone? To sum what we can say?
And it is also catharsis for anger to discharge the anger. So that is what I look at it.
Exactly. So the thing is that this audio visual slide, it can be used for various purposes, and what sir said, I'll start with that this is any musical note, whether this is movement or this is vibroacoustic or this is active or this is passive or whatever, it is always having that cathartic value, right? It is having cathartic value because it is all the music therapy is purely an expressive art form. So you are expressing yourself. So yes, sir, you are very right that this is giving a cathartic mode to your emotions. Then the other thing was that it gives a lot of stimulation in a way, because high note music is there. This is drumming, or this is damru, or this is ghanta, or whatever it is there. The combination overall, the music note, it says that it is to be given to, of course, personality, situation, all these things are there. It's not necessary that every activity which we'll do is to treat to depression only. We can have some other client also. So as far as Damru is concerned, these days people are using it for a lot of music therapy sessions, but we'll see that later. Let us make a move to another activity. right? Be very, very attentive and feel the, get the feel of that, right? So 1, 2, 3. Yeah, when the note comes down, like what happens? You feel that your whole body is coming in that tone. It's not just auditory. That's why I said I will again play it. Just see when the notes they go to the upbeat, you have a different feel. But when the notes they start coming to the downbeat, then you really feel as if you are relaxing. You're each you can feel, you can get the feel of that chunk into the inner core of your body. Just try to get the feel again. Yes. Now the thing is that now whom are you going to give this therapy? With whom you are going to make it a part of your music therapy? Just write about it 1 minute. Because this is something very different from what we saw earlier. That and this very different from each other. Just 1 minute. Yes. Over. Okay. So come up with your raise your hands, please. Yes, Sita.
So again, I felt this can be used for definitely relaxation, and somewhere I felt it can be used for more focus, concentration, and also reducing anxiety. Because the conch sound, it kind of gives a different sense of vibration and resonance. So I felt this can be used for people with a little generalized anxiety. I'm not sure.
Okay. Okay. Yes, Manjula. Manjula, ma'am, please. Not audible. Not audible.
Ma'am, sorry.
Yes.
Yeah, I felt that note is continuous. It's like inertia, and it's like the process of breathe, inhalation and exhalation. At the time of exhalation, we feel like last note, the end of the note is like exhalation. So I think that we can give it to the people who come with the attitude of agreeableness, who are open to change. They know that they want to change from the position from where they are, I feel.
Yeah, very good analysis of personality characteristics as to how, what kind of personality can be getting more benefit out of this thing. So, dear viewers, we'll wind up the things here only. We'll take up one more activity related to that, and then we'll summarize that, but that is for tomorrow, right? So today, let us have that discussion part, right? And then tomorrow we'll take up one more activity in this continuity, and then we'll summarize that what does it mean. Okay.
Ma'am, I have a question, ma'am.
You must have noted down the questions, so you can one by one you can ask.
Yeah.
Ma'am, I have a question.
Please.
A controversial question, ma'am. Sorry to ask this.
No, it's
Ma'am,
okay.
ma'am, music does not have any religion, as we know, but it should be, I came to understand that it should be socio-cultural. Like North India, we can't give Carnatic music to the clients. South India, we can't give Hindustani music. But can it be religion-based, ma'am?
Ma'am, I do agree with your observation, and I would say that yes, it can be given and it should be given, but can and should will not work here, right? Well, what will work here? Suppose there is a person whom I want to study the effect of association, association memory through music, right? And this person is, let's say, from Punjab. He does not know Bengali. He's a Punjabi. And now I want to see the impact of association of memories in the emotional realm of this person. He is a Punjabi. Now, suppose I gave a Bengali Bangla Geet to him and then ask him to memorize what kind of feelings you are having. So that will not be possible, because we want that Punjabi, Bengali, every this thing, they should go together. It should be, there should not be boundaries. But side by side, we should be proud of this thing also, that we are united in spite of that diversity. And Manjula, last week I was there for a webinar on religious religiousness and national integration. And then I said that it is not just 9 religion in India. 9 religion, 2011 census says that there are 9 religions. 4 of them, they are born here only, and 2 of them, they are Islam and Christianity. Their birthplace is not India. They are from, but just see how liberal everybody is for every. Why? Because our preamble is so strong. Our constitutional rights are, anybody can go for any religion. But in spite of that, a family may, we keep fighting also, but then we emerge with more vigor and with more strength. But always indigenous things are very, very minute in Indian context, because that diversity is much more. Diversity is very, very much highly. I went to Santhal, a place near Jharkhand. Santhal and Mundugmar, these are the cultures. And if you are keen to study the tribal psychology as one of the part of cognitive psychology, you are supposed to interact with them. So one of the person with whom I went to that village, I could see his mother. He was in a way hesitant to take me to his mother, because he said, "Madam, you will not be able to see her, because she'll not be dressed up as you people dress up, because there's hardly any clothes." And yes, it was. I said, "Manoj, you don't worry, let me." And then I do not want that every culture should be merged and there should not be religion. Why should there not be cultures? Cultural varieties is something which is very tasteful, and we should always encourage it. No tribe should be merged with the common man. Why? They have their own individuality. Let us try to enforce that individuality part. They should grow within their unique patterns rather than everybody merging together. So that is why, Manjula, I said that every time we decide, not only for music therapy, but any test also, if we decide for psychological test, like most of the time, what do? We just take some foreign made test without seeing whether these items are applicable into that particular socio-cultural context or not. But since it is a foreign test, we blindly use it for that, and then these were the findings, this was positive. That will not do. That will not do. We have to be indigenous, and we should be proud to be so fertile in our musical diversity, but in spite of that, having unity, right? So I am very happy that you thought about this thing and you raised this thing, so that at least we could discuss about that. Yes.
Ma'am, what if that client does not appreciate indigenous music?
Then you can see what are his preferences. What are his preferences? Suppose it happens. Suppose let's say we are talking about Odisha. Some Odia music is there, which the client is not liking. So if not liking, never include that. If preference for Odia music is not there, he is not liking that particular this thing, never include that. Indigenous should be preferred, but over and above, what should be preferred is the preference of your client. Because if his preference is, let's say, for Western music, go for that. If his interest is for devotional music, go for that. That is why music therapy interventions, they should primarily start with the matching part. And matching part does come from the musical preferences. So it's not necessary. Your question is very valid. It's not necessary that if a person is in Punjab and is not liking Punjabi music, so just because we have to be indigenous, we go that music, give that musical piece to know. Go for number one is the musical preference, right? Okay.
Thank you, ma'am. Thank you.
Okay.
Ma'am, actually, you also said about the openness of the character, right? So if
Okay.
his openness, then definitely he could able to accept different kind of thing. And I think I feel that there are more of universal expression of music where if the person is openness, then he can able to feel any kind of music. If it's even if tribe music or even if it's Western, anything, tribe music or something like that. Yeah, but he has to be open because I am very openness, so I can appreciate all kind of music. I like Bengali songs, I like Punjabi songs, I like Marathi songs, then Malayali songs, Tamil songs. So
Yes,
yeah,
Jeevanji, your observation is very right, because openness to experience is that he is not a rigid kind of person.
yeah,
Right? He's a flexible, and if you could see if you could remember the research findings, and I think we have covered that also. The research findings, they say that people who score high on openness, they have preference for diverse musical notes, diverse music, and that way Jeevan is high on openness to experience. So Jeevan's preference is very much matching with the research findings, that he has got the diverse musical preferences. It's not necessary that if I am Tamilian, I have to go for Tamil music also only, or if I am a Gujarati, I have to go. No, it's a variety of this thing coming from. But these music therapy researchers, they focus on indigeneity, because they say that sometimes it happens that suppose 50 years old person, he's not into Western music kind preferences. Let's talk about Lata Mangeshkar. I would just of the track here. She sang one song, Gore Gore Banke Chore Kabhi Meri Gali Aaya Karo, which is highly classical now. But she narrates the story कि when we sang this song, my mother was highly annoyed. He said, तुम लोग इस तरीके के गाने गाती हो. So indigenous जो कल था, whatever was the having condemned kind of this thing is very much popular today. So it is not one music applicable to all, and this is not one music applicable to the person at all situations. So that is why the individualized goals and the particular situation, it is always very, very important, right? Like I'll tell you, if you remember, if you have seen that movie Abhiman, there was Meet Na Mila Re Man Ka. That was the song which was that time Kishore Kumar was upcoming, was not into. People used to say, "Kya Kishore Kumar ke gaane sunte ho?" But now people just run after that song. Kya melodious song hai. Why? Because that was the time which was having those singers like Muhammad Rafi and Mukesh. So people were more into that. So what music was not that much preferred at that time is highly preferred now. And maybe that in the future that loses its preference or it gets double preference, right? So nothing is permanent, right? Nothing is permanent. One size applies all does not apply. One size applies to the same individual in all situations does not apply. And that is why psychology is the need of the hour. Okay, yes, Sita?
So I just wanted to add on to what Jeevan said, that unless as a therapist or as a human being, if I have been exposed to all genre of music, I can probably also use that to introduce that to my clients. So even if they have not been exposed to certain kind of music, if I do expose, probably they will like it. So I would just want to at least check with my client, would you be willing to consider, listening to some other kind of music than what your preference is, and then probably they will. So you can also stimulate that openness within them, which is which we are assuming that they are not.
Exactly. Sita has a very valid point here. And Sita, that way your point is very right. And if you go to the way we proceed with music therapy, right? It does not, or it should not happen that we just get a matching note and we start doing it, right? This is pre-counseling stage. What do? You have explored something, and then you try to get that validated. Okay, whatever you have explored, it's really working, and if working, okay. If not working, then you have to revise and get something else, so that whatever information you have at hand, pre-counseling session, then counseling session, and even in researches also, we have a pilot research. What is the role of pilot research? Okay, whatever hypothesis you have decided, whatever objectives you have laid down, whether they do function or not, whether they do work or not, that is why you do a pilot study. And suppose you find that the hypothesis which you really formulated is not working in your pilot study, you rework on the hypothesis. Okay, maybe that there is some dimension which is left. So the same procedure is when it's not just music therapy, any therapy which you use. And this is something very, very valid, that let us try. Maybe that we are assuming that this may not work, but this is working highly effective in the case, right? So
Ma'am, I have a question.
yes, please.
Ma'am, how do we deal with patients who are older, probably who have dementia, and they cannot convey what kind of music they like or their preferences? And if we want to stimulate some relaxation or some to try to make their memory sustain for some more days. So in such cases, for dementia, do we have any music therapies, or are we going to talk about it tomorrow?
Usha, can we talk about it tomorrow?
Sure, ma'am, sure.
Okay, because that would take a discussion, so we would take it up for tomorrow, right? Any other specific thing which anybody is keen to discuss tomorrow? Because tomorrow, yes.
Ma'am, I just have like a basic doubt. So
Yes.
we spoke about this vibroacoustic therapy, and
Right.
there's like two parts to it. So you actually made us hear this Shiva Tandav, the piece of that. Do you think that would you say that this is like a vibroacoustic therapy music, like, or would it be different to what it is like?
Rashmika, if we go to the theoretical intricacies, then that's a different thing. But
Okay.
Vibroacoustic, if you go to the conceptual domain of this therapy, the sound has to be just audible.
Okay.
Just
Okay.
audible, right? Because if sound is loud, it's loud in a way, so it's audible, not just audible, but it's audible. So then it is doing some other purpose. It is fulfilling some other goal, right?
Okay.
So that audio visual, yes, it can be made vibroacoustic. It can be made,
Okay.
but what way we have seen it,
That's not bad.
the loudness. Because what does loudness do? Loudness, it activates you cognitively.
Yeah.
Okay? Your cognitive faculty gets activated.
Okay.
And then that connection of your emotion and body, harmony, that harmony part, it goes somewhere else,
Correct. Okay.
right? Rather, your brain gets activated here, right? So that way, we can design these kind of vibroacoustic models, tools for us, but then these things are to be
Consider.
made constant, right?
Yeah. Thank you, ma'am.
I think, is there any other question?
No, sir.